Hello everyone, in this video we'll learn about malingering. In clinical practice, healthcare professionals sometimes encounter individuals who intentionally fake or exaggerate symptoms for personal gain. So this behavior is known as malingering. This is not a mental illness but a behavioral pattern commonly seen in forensic, medical and psychiatric settings. This is Rima Stanley, lecturer at M College of Nursing. Objectives of this video is to know what is malingering disorder, external incentives in malingering, epidemiology, clinical characteristics, red flags for malingering, and also diagnosis and treatment. So now first let us see what is malingering disorder. Malingering is defined as the intentional production or gross exaggeration of physical or psychological symptoms which is most motivated by external incentives. So as per DSM-5, they describe malingering as a condition that may be a focus of clinical attention and not a psychiatric disorder. So the key point to remember here is that it is a conscious deception. So, which means that the patient deliberately creating false or exaggerated symptoms. And secondly, there is an external motivation. So, the goal is a tangible external reward and not internal psychological needs. For example, finging pain after a minor accident for a lawsuit, faking PTSD to avoid service, or pretending mental illness to get disability benefits, etc. Now let us see some of the common motives that makes the patient to exhibit malingering symptoms. So this include financial compensation such as like insurance claim or disability benefits, avoidance of work, military duty or examinations or even from schools, obtaining drugs or hospital admission, evading criminal prosecution or legal responsibility, seeking shelter, food, or care, etc. The purpose of all the symptoms is to gain sympathy and attention by showing all these symptoms. So some of the common example includes like faking a limb or using crutches excessively, pretending to have a chest pain for pain medication, claiming amnesia or disorientation in order to avoid accountability, tampering with samples such as urine and blood are the examples of malingering symptoms. Now let us see the epidemiology of malingering disorder. So, malingering is more commonly observed in various settings such as forensic and legal settings, emergency departments, military services, compensation and disability evaluations, prison and custodial settings. So, prevalence will vary but may be as high as 10 to 20% in forensic evaluation. Now let us see the clinical characteristics. So clinical characteristics can be categorized as the general features, psychological symptoms and physical symptoms. The general features include intentional symptoms, production, poor cooperation during evaluation, inconsistent or vague history, symptoms that worsen when observed, and symptom that improves when incentives are removed. While the psychological symptoms include fabricated hallucinations or delusions, inconsistent emotional responses, overly dramatic or stereotype symptoms, poor understanding of real psychiatric disorder. And the physical symptoms include inconsistent pain complaints, neurological symptoms that do not match the anatomy, and unusual or exaggerated physical findings. Now let us see the clinical types. Now, classifying malingering behavior into different categories allow for easier assessment of possible deception. So, the general category is pure malingering, partial malingering, and false imputation. So, what is pure malingering means? It is finging a disorder or illness that is not existed. Most simple to detect because malingers tend to provide unreliable and additional symptoms when describing their supposed disorder, as it is difficult to entirely accurately mimic real world scenarios. While partial malingering is purposefully exaggerating symptoms for an existing disorder or illness. And this type is sometimes difficult to detect because in this malingers would be building on their own genuine traumatic experiences rather than completely falsifying. And the last one is false imputation. So, here the patient inaccurately transposes symptoms from their real experience to the supposed cause of their disorder. So, it entails inaccurate storytelling and would indicate deliberate deception. Now, let us see the red flag suggestions of malingering. So, according to DSM 5, malingering should be suspected when medico legal context is present, mark discrepancy between complaints and objective findings, poor compliance with treatment or evaluation, and presence of antisocial personality traits. For example, a patient reports total blindness but can navigate the room without difficulty. So, here are some of the differential diagnoses that one needs to find out, such as conditions include factitious disorder. So, the difference is that the symptoms produced is intentionally but without external gain. Somatic symptoms disorder is somehow symptoms are not intentionally produced. Conversion disorder, they are neurological symptoms that occurs unconsciously, while true psychiatric disorder, the symptoms are genuine and consistent. So, when we look in all this diagnosis, in malingering, they are intentional and as well as there is an external reward. Now, let us see the assessment and diagnosis for malingering disorder. So, the diagnosis of malingering is based on history, physical examination, and psychological tests. So, no diagnostic laboratory tests are available to diagnose malingering. However, laboratory test is useful to exclude organic cause and genuineness of illness. So, as such, there is no single test to diagnose malingering, but some of the assessment will include such as detailed clinical interview, review of medical and legal records, behavior observation, and psychological symptoms testings, which include, for example, the F scale, the MMPI, the test of memory malingering, Ray 15 item test, the negative impression management scale, etc., are all the examples of psychological testing which is done for patient with malingering. Then, along with that, there should be a collateral information from family or staff. So, overall, diagnosis should be made carefully and ethically. Now, coming to the management and treatment, so some of the important principle to be kept in mind while managing is that malingering does not require psychiatric treatment. Okay, some of the management strategies would include maintain a non-confrontational approach, avoid direct accusation against the patient, and set a clear boundaries, especially when patient exhibits malingering symptoms, to address the underlying needs, which may include the social, legal, or financial area. Limit unnecessary investigation, document findings objectively, and in some cases, counseling may also help to address stressors or coping skills. Now, let us see the role of a nurse or a mental health professionals. So, some of this role will include to observe behavior objectively, maintain therapeutic neutrality, avoid reinforcing maladaptive behavior, to ensure ethical and legal documentation, to provide appropriate referrals when needed. Apart from that, what a nurse must do is to have an ethical and legal consideration, which involves such as like false labeling, which can harm the patients, then, to maintain patient's dignity, very important, to ensure the confidentiality, and also balance care with medico legal responsibility. Therefore, malingering is a deliberate behavior motivated by external gain and not a psychiatric illness. So, therefore, accurate identification requires clinical skill, ethical judgment, careful documentation, and healthcare professional must manage such cases professionally without confrontation, ensuring patient safety and system integrity. Now, the keynotes: malingering is an intentional and motivated, and this is not a mental disorder. Therefore, a careful assessment is essential to confirm malingering disorder, and management focuses on boundary setting and not an actual treatment or therapy. Reference taken from WebMed and Psychiatric Times. Thank you for watching this video.